Welcome everyone once again for the session. And this session is about revenue cycle management. It is an integral part of healthcare. It is integral part of every other domain, but in health, we are going to concentrate on the revenue cycle management in US healthcare. So we have our speakers, Rajesh and Hema. So Rajesh and Hema both have an immense experience in revenue cycle management. I would give the stage to Rajesh to start with. Rajesh, go ahead.
Yep. Thank you so much for the wonderful opportunity, Malar. And I'm happy to be part of this talk and explain about the revenue cycle management. Hello, everyone who have joined this session. So let's start about the revenue cycle management. And before we deep dive into the presentation and the slides, I would like to explain like why revenue cycle management is important in healthcare. So there are a multitude of factors that go into running a successful medical practice, right? So one of the most important one is revenue cycle management. So the first reason why RCM is important. So I will just come up with the acronym revenue cycle management as RCM because I don't want to call it again and again. So it'll be easy for you guys to understand as well. So the first reason why RCM is important is that it's bridges the gap between the business to healthcare. So even though healthcare deals with treatment of those who are ill, so they are still need of to collect the revenue, right? So many of the healthcare provider needs to be paid for the services. So there are certain organizations which do provide free services, but there are maximum amount of healthcare providers who needs to be paid for the services for the patient being treated. So this means that not only does the doctor have to see the patient, the he or she also has to deal with spreadsheet, taxes, revenue calculation. So these sets of tasks can also be mentioned as administrative task, and it cannot be taken care by the doctors after they visit a patient. They address the issues, so they can't be going on with the administrative task. So in order to avoid such scenarios where the head doctors works on revenue calculation, so there's a fully fledged revenue cycle management, the RCM environment, which needs to be existed in the healthcare provider's place. So one of the most obvious reasons why RCM is so important comes from the way that these administrative tasks are automated. So which helps the healthcare providers paid for the services, and they don't have to uh, wait for a lot amount of time for the healthcare providers to be paid. So since revenue cycle process is one of the complex structures, the healthcare providers have turned over their revenue cycle management to the companies that handle this complex process with specialized agents and licensed technologies. So these technologies, licensed technologies, helps to manage the healthcare provider revenue cycles. So with this RCM process and the third party taking over the revenue cycle management process, healthcare organization ensures like they are properly and quickly reimbursed for the services. So this is why RCM is all important, and this is all about the RCM, why the important factors that go into a successful medical practice as well. So now, Malar, I would request you to go to the next slide, which is about RCM. Yes. So coming on to about the RCM. So revenue cycle management is a strategic process, and okay, so which is used by healthcare facilities to effectively and efficiently manage the financial processes and activities associated with healthcare services, from patient registration to final payment collection. So say for example, you're going to one of the healthcare providers, you you have certain case of issue which needs to be sorted out. Say for example, you have a pain in a hand, or you need to have a minor surgery because of a cut. So you go to the healthcare provider into your network, get those things appointed, and then all the process starts. So the leading RCM solution providers are so successful because they provide the system that not only concentrates on the claim, but also helps to communicate with patients in each phase. So once the patient books an appointment, the data is added into their RCM system. From there on, the system takes over and automatically sends over relevant information, insurance information, or the reminders to the respective patient for whom the appointment has been booked. And once the patient issues are addressed, so it's likely that the patient owes some of the payment, right, to the healthcare providers. So in this case, as I mentioned you earlier, that the healthcare providers have already turned the revenue, handed over the revenue cycle management to third-party companies. The RCM simplifies the claim processing and submissions. So by this, the healthcare organization gets paid as soon as possible. So this is about the RCM, where from initial payment encountering till the final payment is achieved, that's where the RCM is totally into a picture. So we will be looking into the RCM cycle in the forthcoming slides. However, I would like to also walk you through some key objectives as well. So the key objectives is nothing but where you have to consolidate all the data in one accessible real-time review. So you have certain tools which have all this data in a web application tool, which you see in one single page rather than hovering in one section to other. So that is one point. And then you'll have to make sure the data is protected. So you have heard about the HIPAA acts, right? So those needs to be protected and it should not be uh, attacked by some other malware or some other issues. So we'll have to make sure the information is protected, and we'll also make sure that the high quality care is to be delivered. So by doing this, the other objective also comes into the picture is we have to make sure we eliminate the cost entry errors. So the cost entry errors comes into like where you have the medical uh, while you prepare the medical billings, right? Over there, you will make sure like all the codes, the aspects of the treatment needs to be recorded in a single piece of paper, and it should not be leading to an error. But because if it leads to an error, the claim can be denied, or there may be delay in the reimbursement to the healthcare providers. So there are many such cases which we'll be looking into further, but these are the key objectives which is one of the aspects for RCM. Then it's about multi-department revenue collection. So there'll be many departments like in an healthcare providers, right? So it eases out, this RCM process eases out the multiple department revenue collections as well. So this is about the key objectives. However, now before we deep dive into RCM cycle, which will explain about the flow of initial patient encounters to the final payment, I would like to cover a few topics which are about providers, payers, prior authorization, and health insurance cost terminologies. Because I think that few of the associates must be aware of it, but still I'm going to walk you through this. So the first thing is providers. So the healthcare provider is a person or an entity that provides medical care or treatment. So the healthcare providers includes doctors, nurses, hospitals, medical supply companies, and other professionals. Now you see like certain people every time gets confused about the company. So they refer plan or a health insurance company, but an administrator does not deliver care. Instead, that entity pays the person or the other entity provides the care. So the healthcare providers are those who provide care for certain issues which the patients are facing, and the services are rendered. So this is about the healthcare provider. And you see like you see a sign in the image, right? We care sign. So the we care sign showcases that the people, that the healthcare providers care about you and provide services. You don't see these kinds of sign from an insurance company, right? So because they cover all the insurance plan and they pay for it. But whereas the providers care for you and they make sure your all your issues are sorted out. Then we move on to the payers. So payers are who like an individual or an organization that pays for the care services that an administrator provides to a patient. So payers are like who pays for the individuals insurance coverage. Say for example, I've been covered into a medical plan and I have taken an appointment and I have been treated for a certain condition. So what the company like the healthcare provider will do is he will raise a request to the insurer and the insurer will pay back the services rendered. So the payer's functionality and the scope is about paying for the services. So that is where the payer comes out. And you also see like we have payers of two types, like private payers and public payers. So the private payers are the private insurance company and provider networks such as HMO and PPO. So HMO is nothing but the health maintenance organization, and PPO is nothing but the preferred providers organization, which comes under the private payers. So HMO has limited set of access. They give you access to doctors and hospital within a network, whereas the PPO, they give they provide a network of doctors and hospital, but with less stringent, where they allow you to go outside networks as well. So you will have many plans with medical HMO plans and medical PPO plans, which the private payers offer. Then comes the public payers. Public payers refer to the healthcare given by federal or state governments in US. So since a public entity, the government is sourcing and contracting the providers to offer in the network. This makes the programs such as Medicare and Medicaid public programs. So I hope like everyone has heard about what is Medicare and Medicaid. So Medicare is for older adults who are 65 and above, and people with chronic conditions and disabilities. So the people who comes under this criteria, they can opt for Medicare plans. And the Medicaid is like for the low income people for all ages and help provide the healthcare services at little cost or no cost as well. So that's up to the plan. So these kinds of plan comes under the public payers. So this is all about the providers and payers. Uh, yeah. So coming on to the next slide, which is about prior authorization. So first of all, this prior authorization is nothing but when a healthcare provider determines that a patient needs a specific procedure, test, or medication. Say, for example, I'm going to a healthcare provider and I need certain tests to be done. What happens is the provider then checks the health plan policy rules or formally to determine if the prior authorization for the prescribed course of treatment is required or not. So it is the duty of the healthcare provider to make sure to check the insurance plan whether the prior authorization is required or not. So if you see the diagrammatic representation, which clearly mentions, I've given a flow which clearly mention like the healthcare provider prescribes a drug. Then the prescription is sent to the pharmacy. So now the pharmacy notifies to the provider that the prior authorization is required basis on the plan. So now the healthcare provider has to start the prior authorization process where he will check the requirement. He will contact the health insurance plan. Say, for example, he's having UHC medical plan. So the employee is enrolled into UHC medical plan. So whatever the preconditions are there, he'll have to follow those procedures. And once the form and all the medical documents are filled, he will again send this back to the insurance company. If the insurance company approves the prescription of the drugs, then the drug is dispensed from the pharmacy. If not, the provider has to deal with the insurance company to make sure this process is authorized. But if there is no prior authorization required, then he can just directly go with the claims. So prior authorization for certain medical plans, which need some form to be attested and medical documents to be sent to the insurance company before uh, the next set of process is taken care. Yeah, Malar, could you go to the next slide, please? Yes. The next thing is health insurance cost terminology. So there are many cost terminologies, but I would just like to focus on two, which is co-payment and deductible. So the co-payment is nothing but a contribution made by an insured person towards cost of treatment and services. So I have given an example here, right? So I go for a checkup with a doctor and the insured person has to pay for a co-payment of $25. So with the insurance company paying the remainder of the cost. So say for example, the bill cost me around $200. So basis on the co-payment policy, I'll have to pay the $25 and rest is covered by the insurer to the insuree. Then it comes on to the process with deductibles. Deductible is the amount of money an insured person pays before the insurer starts covering the cost of medical expense. So it's nothing but, say for example, I have opted for an medical plan or a dental plan, and there is a deductible of, say for example, $2,000. Now I go for the checkup to the doctor and doctor says me that I'll have to pay $100. So here the insurance company will not be helping you out with the $100. You will have to pay that $100 amount on whatever charges you have paid for the visit. So the $100 will be there. So you still have $1,900 most more to reach to the deductible, right? So now the doctor again orders for X-ray and then he also recommends for the knee surgery. So it totally the cost extends more than $2,000. So if that happens, now you have reached the deductible limit. So when you reach the deductible limit, and thereon the pending amount will be taken care by the insurance company and it will be paid by them. So this is what about the deductible process. So these are the two important health insurance cost terminologies. Yes. So next comes our main topic, which is about the RCM cycle. So the RCM cycle has many steps into it. It starts from the referral, the patient registration, patient's visit, diagnosis, charge review, billing, adjudication, payment posting, denial, payment billing, collection process, and auditing process. So as you know from the term, you see like these are the first three terms like physician ordering referral, patient appointment, patient visits are very layman terms and you understand that. So it's like the patient registration appointment happens when patient goes for a selected provider, healthcare provider. So when the patient visits the hospital and gets the treatment from the doctor, the provider of the service generates diagnosis codes and procedure codes based on patient illness. So which covers under the diagnosis and charge capture. So once that is done, the provider has selected certain diagnosis and procedure codes, right? So which for the respective patient. So here the medical coder or a software is used to review and scrub the code. So scrubbing, the term scrubbing is nothing but your like how we do audit certain times in our project, right? Same ways, the scrubbing is a method of auditing claims before a provider files them to the insurance company. So this process is nothing check whether the practice medical claims does not have any flaws and that might not lead to any denial of claim. So this is where you have this charge review and scrubbing process. The next comes the billing and claim submission. So billing and claim submission is nothing but the claim has been created by the healthcare providers and those are double checked before submitting. So once that is done, the healthcare providers will be submitting the claim and we will be deep diving into the billing methods, like how the billing, medical billing and medical coding is done. We'll be seeing that in the forthcoming slides because these are the important terminologies in revenue cycle. So the first four points you see in the flow are you understand that, but we are going further into billing and claim submissions, adjudication, payment posting, denial management, patient billing, and collection process. So these will be looking into the upcoming the upcoming slides. Yes. So what is medical billing? So here the healthcare claims has to be submitted to the insurance company for the purpose of obtaining the payment or medical service. So what happens is there is certain flow. So it starts with the registration and it goes on with the financial responsibility of the visit, like whether the how is the uh, like the financial responsibility describe who owes for what particular doctor's visit. So once the biller has been pertinent, once the biller has the pertinent info from the patient, the biller can determine which service are covered under the patient's insurance plan. So these kinds of sections have been taken care in medical billing. So once those processes are considered, uh, we translate all these aspects into a bill, and the billing the medical biller follows the claim process, ensures that the organization receives the reimbursement. So I have given a diagrammatic representation of the medical billing, which is in the next slide. Um, yeah. So here I have clearly described about the steps in medical billing. So which is registration, establishment of financial responsibility, where we are checking the coding and billing compliance, preparing and transmitting claims, monitoring the payer adjudication, generating the statement or bill, and assigning the patient payment and arranging collections. So let's deep dive into this one by one. So registration, as you know, when a patient calls to set up an appointment with the healthcare provider, they effectively pre-register for the doctor's visit. So if a patient has seen the provider before and there are information already in file, so then the administrative team will take care all the information, like they already have it, right? So they just fetch those information and have it handy. The next thing is establishment of financial responsibility. So here the administrative team has to see like which services are covered under the patient's insurance plan. So if the insurance coverage differs dramatically between the company or the individuals, so the biller must check each patient's coverage in order to assign the bill correctly, because if this process is missed, it can also lead to denial. And the next one is checking coding and billing compliance. So the medical biller takes the super bill of the medical coder. Super bill is nothing but the uh, accumulation of all information into one, which will be sent to the insurance company for while claiming. So the medical biller takes the super bill from the medical coder and puts it either into a paper claim form or into the proper practice management or a billing software, we would say. So they update all the information into the billing software. So the biller will also include the cost of all the procedures in the claim. And once the biller has created the medical claim, he or she in the administrative team should be responsible for ensuring that the claim meets the standard of the compliance, both the coding and the format. So the medical billing has all the information about what patient is going for. Like if he's going for some certain surgeries, those codes needs to be mentioned properly and in a proper format. So that is where the medical billing is very important. So the accuracy of coding process is very important, and it is left up to the coder, because the medical coders are available in the administrative team who takes care only about the coding, and they also review the bills to make sure these codes are accurate and proper. Because if it is inaccurate or improper, the the insurance team will. And next is preparing and transmitting claims. So as I mentioned, like HIPAA Act. So HIPAA Act is nothing but the Health Insurance Portability and Accountability Act. So you all know. So the health in entities covered by HIPAA have been required to submit the claims electronically, except in certain circumstances. So most probably, you'll have to make sure these claim standards are followed based on the HIPAA Act. And there is also nowadays there is a very unique or a regular third-party vendor called clearing houses, right? So with the clearing house is the one of the medical billing team, or which acts as an electronic data interchange. So clearinghouse in medical billing acts as an electronic data interchange. So this what does it is it makes sure the claims have no error. So if they come across a claim with any error, so those claims will be dropped and the claims without error are converted into an insurance specific format. So this is what the third party organization do. So the clearinghouse third party organization do. And they also see like how many amount of claim has been received, total number of clean claims, total number of dropped claims, and reason of dropping claims. So everything is taken care by the third party organization when they go on with the medical billing process. And there are manual claims as well, but manual claims are very tedious, because as I have explained you, there are certain sets of processes which need to be followed. Like the coding needs to be proper, the patient information, the demographic information needs to be properly updated while submitting the claim, right? So the super bill needs to be accurate and without any flaw. So manual claims might risk to high rate of errors, and it might take also more time, and which will also take more time for providing the reimbursement of the respective bills. So it is very tedious process for manual claims. Next comes the monitoring payer adjudication. So adjudication is nothing but once the claim reaches a payer, it undergoes a process which is nothing but adjudication. So the payer evaluates the medical claim and decides whether the claim is valid or not. So if it is valid, then the rest of the process is taken care. If it is invalid, the adjudication uh, process comes into the picture where they accept, deny, or reject. So adjudication process will be explained later on, but I would like to just cover this point here. Then it is just the rest of the stage where we generate patient statements or bill, and this is very easy, where the patient bills are raised. So once the biller has received the report from the payer, it's time to make the statement for the patient. So the statement is the bill for the procedure. So uh, once the payer has agreed to pay to the provider, the portion of service whichever is mentioned in the insurance copy is being reimbursed, but the other amount has to be paid by the patient. So this is where it comes with the generating patient statements or bill, and then the final stage is assigning patient payment. Yeah, moving on to the next slide, which is about medical coding. Yes, so as I said, like when we are preparing the medical bills, uh, the coding format should be proper, right? So here the medical coders make sure all the codes related to the issue which is in the patient needs to be addressed. All the things needs to be updated in the medical bills. So here the medical coding professionals make sure the codes are applied correctly during the medical billing process, which includes abstracting the information from documentation, because see, medical coding has sorry, the medical coders have certain sets of book which needs to be followed, or the guide. So basis on that, they see all the appropriate codes and update it in the medical bills. So this is about the medical coding, and I have also shared a few of the slides which explain about the format of medical codes. Could you please go to the next slide? Yeah, so there are these sets of types of medical coding, like the CPT, the current procedural terminology. We have ICD-10 codes and CPT modifiers. So there are certain types of codes which have been followed by the medical coders while updating the medical bills. Yeah, can you go to the next slide, please? Yeah. So this is the CPT coding format. So where you see like we have 4 columns there, which is about services, codes, description, and when it is used. So I've just mentioned one example, which is ENT. So this is the CPT code format. And then the description is about the EEG, and when it is used, it is used during routine EEGs. And there is about uh, nutrition services, and when it is used, the radiology and the speech. So these are kinds of services which has their appropriate codes, and if a patient are going through these certain cases, these codes needs to be updated in the medical bills. So, and it should be accurate. So this is about the coding formats. Yeah, this is one of the other coding format, which is ICD-10, and they have their own coding structure mentioned over here, and it's diagnosis type. So if, say, for example, if it is R51, that goes with the neurodiagnosis type. So this is how they update the medical bills. Now I will hand over the session to Hema, who will proceed the further slides.
Yep. Thank you, Rajesh. Moving on to the next step in the RCM in the charge entry. So basically, it is a set of processes by which the charges for the medical services that has been taken are submitted to the appropriate payers for billing. So this process generally starts with collecting all the relevant information that is related to the medical services provided, including the patient demographic information and insurance information, the codes, and the associated fees. So the healthcare providers must ensure that all the information that has been entered into the billing system is accurate and complete to avoid any kind of errors. So once the charge, excuse me, so once the charges are accurately recorded, then they post it to the billing system and submit it to the insurance provider for the payment. So basically, it ensures that you receive the correct payment for the medical services that has been provided to the patient. So any kind of incorrect information that can may also lead you to the denial of the claim or sometimes inappropriate reimbursement from the insurance company. So this is what charge entry. So once all the details have been recorded, the next step here is the claim submission. So claim in healthcare industry is nothing but are the requests for the payment that the healthcare provider or the patient send it to the health insurance company for the item or the services that has been covered by the health plan. So it is one of the very crucial steps in medical billing. If the bills are not submitted properly, it can lead to delays in payment and increasing the hassle for both the provider and the insurance company. So that's why it is very important to make sure that all the information that you have provided in the bill is accurate and complete. So this includes basically the patient name, address, all the demographic and insurance related information. So it is also important to make sure that all the services that are were provided are listed in the bill. So this will help you, to ensure that there is no delay in the payment. So during the claim processes, the below mentioned aspects should be considered for a clean submission, like verifying whether the patient eligibility at least 2 days before the service date. So when after after a patient has registered, the care provided but verify that the patient insurance what it is. It generally helps them to confirm that the patient has adequate coverage for the care that they are going to receive. And second thing is whether the what are the patient policy benefits are, whether the patient insurance provider requires any kind of pre-authorization, etc. So the next step is to remain updated. Malar, can you keep the previous slide? Yeah, thank you. So the other steps are you have to remain very much updated with the medical coding regulation. As Rajesh has mentioned in the previous slide, these regulations and updates around this coding system are constantly changing. So it is very difficult, to stay on the top of them. So that it is said it is very much important to, know the current coding. Otherwise, your claim submission could be denied or paid or at a lower rate than necessary. So this will help you to fill any incorrect kind of codes for the diagnostics or the test that you have taken. Also, we can check whether the any kind of uh, quality checks you have to do. You have to check everything twice. It's very important, whenever you are submitting a claim, it has been scrubbed and edited from all the errors. And finally, the maintain a proper medical documentation. So it's better your practice is maintaining a documented medical record. So the more effective it will be throughout the whole billing process. So the care provider, they transcribe their notes and other clinical documentation into standardized medical codes. So they use this code to describe medical diagnosis, procedure, prescription, and the supplies and why they have taken it. So this specify the codes to help them any kind of rework they have to do or any kind of mistake to be filled up in the form. Okay. Once the payer has received a medical claim, the adjudication process happen. So this process is follows as to confirm whether a claim is duplicate or not, make sure all the required details are available to the process, and determine if the benefits are allowed for the services. You can see it is to check or decide whether the medical claim that has been submitted is valid or not, and how much of the claim the payer will reimburse the provider for. It is a stage whether you can say whether a particular claim is accepted, denied, or rejected. If the claim is accepted, the payer will issue the provider reimbursement and charge the patient for the remaining amount. But if the payer may deny the claim, the patient has they can also deny the patient they have some insufficient coverage or they did not get a pre-authorization for a services. So this is you can say a checkpoint where the administration they check the claims detail and everything like that. Okay. uh, yeah, moving on to the next slide, we have payment posting. So payment posting, you can also call it as a cash posting. After the adjudication of the claim from the payer, the claim will be either paid or denied, and the document known as the EOB or EOR, like explanation of benefit or explanation of review, will be sent to the healthcare provider and the insured person. So this particular document will cover like what are the services that you have taken, and if it is getting rejected, what are the explanation, like why it is getting rejected, or why what are the different factors due to which it got rejected or it has been approved. So this is there. So the claim will be only provided to the provider if the patient has signed the AOB document at the starting. So the if the patient has not signed the assignment of benefit, then the payment will directly go to the patient. Right. Okay. So the next one is denial management. If your claim has been approved, then well and good. But what if your claim is denied or rejected by the payer? Once the payer adjudication is complete, the payer will send you a report, as I mentioned, like in the EOB, detailing what and how much of the claim they are willing to pay and why. The report will list all the procedure that the payer will cover and the amount the payer has assigned for each procedure. So this often differs from fees to fees listed in the initial claim. The payer usually has a contact with the provider and stipulate the fees and reimbursement rate for a number of procedures. So the report will also provide the explanation as to why certain procedure will not be covered by the payer. This is when the denial management is come into the picture. It is a process of analyzing and resolving the reason why the claim has been denied by the payer. So the process typically involves the following step, like identify whether this has been denied or not, doing the analysis, like the insurance will provide the EOB, so you will know why the claim has been denied, what is the corrective action we have to take, and the changes that we have to make. Once that has been known, then we comes to the appeal, like you have to determine the reason of the claim denial. You can submit an appeal. You can send them back any claim to the payer for additional processing. And once that has been sent out for additional processing, then we have to involve like keeping a tracking of the status, the progress, and any kind of documenting the action taken or generating the reports. So some of the very common factors like why the denial is happening in the medical billing is due to missing information. So you have missed some of the of I can say important factors like the codes, or your name something like in the form, something you have mistyped, anything you have a typo error, so you it's related to a patient name or in the error claim date, or sometimes it's related to like you have claimed for something which has been not covered in your insurance plan. So these are like various factors due to which also your claim has been denied. Okay. Okay, next slide. So, so once the account, like everything you have known, you have again mm, given an appeal to the claim, or whether your claim has been uh, validated by the administrator when it has been approved, then it comes to the account receivable. So account receivable in healthcare are the invoices or the reimbursement owed to the medical practice, hospital, or any other healthcare insurance. So this unpaid accounts may include outstanding patient invoices or insurance company reimbursement. So once your practice bill a patient or submit a claim to a health insurance company, the AR process begin. The patient pays the invoice or the insurance company reimburses your practices, and the account is no longer in AR. Like in healthcare RCM, we categorize this AR based on our age. Usually, it is like a 30 days bucket. It is like 1 to 30 days or 31 to 60 days. So, if we take like an AR is greater than 90 or like that, so this is like the percentage of AR that it is older than 90 days, or the percentage of invoices or the claim that we have gone unpaid for 90 days or more. So our RCM expert, they recommend keeping it to the 10% or less, so that you can cover it up on the very less day. So many healthcare practices have very tedious manual billing processes. Not all the processes are more time consuming. There are also some other prone to errors. So automating this claim processing and scrubbing can reduce these kind of mistakes or any rejection and denials, which means claim less than in the AR and insurance company reimburse your practice faster. Okay. So these are the RCM compliance. So the RCM compliance program, it generally promotes the compliance with applicable laws, regulations, and policies pertaining in bill reimbursement of professional hospital and clinical research activities. So these are the various activities that has been carried out in RCM compliance program. You can see here like we use the auditing and monitoring the compliance with coding, assigning precise ICD, CPT codes, complying with HIPAA guidelines, monitoring the accuracy of diagnosis, and procedural coding. So, hospitals can prevent any kind of fraud and abuse within the healthcare system by emphasizing compliance and accuracy in the RCM. So claim management, processing, payment, and revenue generation are like very important or essential aspect of RCM that serve as a hospital first line of defense against any issue related to the fraud and abuse. So this compliance helps us in keeping us up to date with the claims that we are doing or provide any kind of errors while doing it. Okay. Moving on to next slide is the RCM trend. So these are the various RCM trend that has been practiced in our system. So this is like the medical practices will focus on the patient first approach. So we have various technologies. So using the technology for improving patient engagement, practices generally focus on patient by digitizing with such as workflow as booking appointment, processing, and handling the billing. So more and more the patient are engaged here. They have this technology to provide them a hassle free I can say work to do. Second one is the more telehealth opportunities and make appointment more convenient in each patient. So offering telehealth options to the patients could spell the difference between more appointment being cancelled or more appointment being kept. So if like earlier what you used to have, like people has to go to the hospital, they have to book appointment, if they have to cancel anything they have to go there and do like that. So if we have a telehealth option, so it will be easier for a patient to book or cancel any kind of appointment they want to do. Third is like the analytic and other data tools will take the center stage. So gathering the patient data on how they are being served, you can expect that your team will start to make more use of software than to make prediction about a patient behavior, such as tracking the pattern to see who is taking a long time to pay bill and how many bills they have done, why it is getting processed, whether the pre-registration has been done or not, like that. So these kind of behavior they can track it. And finally the machine learning in the concept with pair portal. So ML algorithm are trained using historical data to produce insight. It makes improve decision making and optimize health outcomes, which are helping payers a lot by improving the status of managing denials. So these are the like various trends you can say which are available in the RCM as of now. Uh, Next, so this is what I have explained now. Uh, Next slide. Okay, so the RCM companies. So as you know, like RCM is a complex process, and the healthcare organization may find it difficult to manage it in house. As a result, many medical practices outsource this work to a third party RCM companies. So these are the list of some of the top companies that provide these services like Aetna, eClinical Work, Ethilas, Corinius, and other. So these companies, they provide a varieties of key features and services as it has mentioned in the PPT, like they have this e-clinical work. So this practice model will handle your billing in the RCM model. So they can provide, they have a alert dashboard that can prioritize your medical claim to avoid any missing timely filling windows, or they will show you the performance tools to evaluate what has been doing. So all these kinds of dashboards and inventory allocation you can see here, these company will provide with the help of e-clinical works. Similarly, we have the billing blue RCM also, which provide the insurance verification and the claim follow up or the denial management. So it generally helps the hospital and the health system with end-to-end billing. So this billing you can say from starting from the billing, the collection, the claim processing, the denial management till the final stage. So it will keep a check on those things and complete from end-to-end process. Okay. So finally, the future of RCM. What is the future that the RCM hold? As you can see, we have now AI or ML. So the future will be like automating the technology, like using this technology to automate the process, like doing the registration, the care management, the medical coding. This can also be accelerated and can be used in our healthcare system to avoid any kind of can say stoppage that a patient will face during processing you claiming for a bill. Second is like the future prediction will also help the payment transaction between the payers and provider to have less friction. So you can see like why a payment is getting delayed or whether it has been uh, went to the last provider or not. So all this kind of thing has been kept here in the RCM system. Since RCM is a very key integral part in the healthcare system, it is very much important, to know where it is start, how it is starting, and other thing. So, so this is the last stage of RCM. Uh, Thank you very much, team, for listening to this and join the meeting. If you have any question related to RCM, you can please send out the question, or you can ping me or Rajesh. We can definitely help you guide. And also, if you have any feedback, you can let us know.
Thank you so much, Hema. Thank you so much, Rajesh. And thank you so much, everyone. And please post your questions. Yeah, Atul, do you have any
Just
question?
once, yeah. So I saw ICD-10 as medical codes, right, or coding. Do we have something in terms of ISO or something for this? ISO for medical codes or ISO for HIPAA, something like that, some global standards.
Rajesh or
Rajesh, do you
Hema?
want?
Yeah. Go ahead. Rajesh, do you want to take up the question? Rajesh?
Am I audible?
Yeah, you're audible.
Yeah.
Yes. So the ISO codes falls in the medical equipment section, Atul. It doesn't comes with the coding structure. So coding structures are these four types which I mentioned, right? So those comes into the medical coding aspects.
So if I ask specifically, example in India, do we follow ICD-10 or something else we follow?
Just would like to add, so actually ICD-10 codes, this is international classification of diagnosis that's taking place globally. Those ICD-10 codes are correlated with diagnosis. CPT codes correlated with current procedure terminology procedures, you see. So those codes actually play the role in healthcare, clinical part. Not just, they are not applying to medical device.
Okay.
Mm-hmm. Those codes actually set with healthcare providers. Healthcare providers are the next nurses, doctors, healthcare facilities. So everyone who possess the license and can provide healthcare services, medical surgery, consultation, general practitioner, physician. So we have different doctors according to the specialization.
So you're saying there is one code for all the heart surgeons, there is one code for all the
CPT. No. We have the global asset of ICD-10 codes. So for me, if I'm just, for example, used to play the role of therapist, yes, so I can use the category of codes that belongs to the category of therapy. If I am the surgical, so I can use the category of surgical codes. You see, from the ICD-10 codes. These codes actually stored in government site. You see, so in if you are talking about the USA, for example, a center of Medicare and Medicaid site, and every year these codes of asset changed. Some codes are deleted, some codes are updated according to the pandemic, for example, COVID-19. Actually, those codes, so in general, we have 72,000 of ICD-10 codes. You see, and all codes used globally, all doctors uses such kind of the same codes of asset globally, the whole world, in Ukraine, in India, in the USA.
Okay, got it.
Yeah.
Yeah.
Thank
Thanks,
you for
that
the
helps.
question.
Yeah.
Thank you.
Any other questions from anyone?
Is there anything for dispute management in this revenue cycle? So suppose I have to raise a dispute that whatever I think should be covered is not provided, and I raise a dispute against
Atul, you mean
my.
denial management? What dispute?
So denial is
You are
like, suppose
sorry.
my expense is 100, right? $100 maybe, and instead of $100, I'm getting $80. So $20 is in dispute now. That I should get $100, but instead the uh, payer paid only $80.
You
I'm
are
not
talking
talking
about the
about the rejection where 100
yeah.
to 100 is rejected. I'm talking about instead of reimbursing the claim amount of 100, I got only 80. So 20 is in dispute now.
Atul, like when you get a when your claim get denied, you generally get a explanation of benefit. Like in that particular document, it will say like what are the services that you have taken, what is the charge that has been it has been assigned to each of that. So there only it will be said like how much has been taken and why the other half has not been reimbursed and all mostly. Yeah.
Okay.
Yeah. Any other question?
So looks like there is very interesting topic, and I would like to recommend that we need to deep dive. And actually, the next series or the next webinar also will be dedicated to this. Sorry, to this topic, because we need to deep dive into this, like calculation, some split decision between the primary payer, yes, secondary payer, yes, some patient responsibilities. If you are talking about the deductible, copay, co-insurance, actually, Mala, our colleague already yes mentioned about this in our slides. So thank you, team. You're really great. Did a really great job. Thank you very much.
Here, Tatiana. We will try to do some more webinars by deep diving the coordination of benefits and how claim processing is happening in the real world in the payer system. So that
Would
will
be very
solve those
nice.
details. Yeah.
Would be very nice, because this is like the very complicated how would you say
Yes.
topic and business logic behind this. I would say.
Right.
Thank you very much. Yeah.
Also, I want to highlight one more thing. We are trying to create a learn course only dedicated for claim processing. So you will get in-depth details about claim processing and how the logic formula, etc., in that L&D course as well.
Sounds great. Thank you very, very much.
Thank you, everyone. If there is any more questions, please post in the chat, and our colleagues Rajesh and Hema will try to answer that. Thank you so much, everyone, for joining, and I hope you will join in our future sessions as well. Thank you.
Thank
Thanks,
you.
Rajesh. Thanks, Emma. Thanks, everyone.
Yeah.
Bye.
Happy
Thank
Friday.
you.
Bye.